So we'll get started. And we wanted to get started with the community agreements before we begin with the review of the OARs. So we wanted to make sure that community agreements are said before we begin. So is participate and be present to the best of your ability. Understand that we are collectively learning and growing. Create a safe space to allow for dialogue about our work. Strive to have inquiry over judgment and assume positive intent. Be respectful with your words and communication. Communicate in a way that works for you. Invite laughter, compassion, and gratitude into the conversation. Acknowledgement is not agreement. Understand that some things may feel unresolved and take care of our minds and bodies. And with that being said, we'll begin with the OER review. So we'll start off with the purpose, and this is OER 411-03900, line item 14 to 29. And if anyone has any feedback on this section. Beth.
Hi, this is Beth Ann Darby, and I just want to start by saying that we got this so late, and it is substantially different than the last round. I don't think it's reasonable to expect substantive comments, and I continue to have concern that it's not clear to everyone how this program is differentiated from programs that are already in place. I don't think that the agency has helped us understand what already exists and why this program should have different rules and not just be aligned to the same thing. So that's where I would like to start. And I'm really worried about this process, the way you've set it up, and that we are not going to have an opportunity to have meaningful dialogue by just asking us about different sections. I liked it better when we were going through bit by bit, because then it felt more intentional and it was clear that we were all on the same page.
Thank you, Bethan. And we did provide OER summary as well. We understand it's a lot of pages, but it's not doable because it is over 90 pages. So we're hoping that people had the chance to review the OERs, and you guys are welcome to submit any comments or feedback to our generic email, and we'll post it on the chat. That way you guys can have access to that as well. You're welcome. We can give you a call as well or anything to help with getting that feedback provided. And we do understand, but unfortunately we do also have a tight timeline that we have to get through. And so with that being,
I have a little, I'd like to respond to that. I'm not trying to be argumentative, but we just got this a couple of days ago, and it is very different than the last round. And while you do have a tight timeline, I'm also very concerned about getting these rules right so that it really does implement a program that's really important and in the correct fashion. And so, yes, we will certainly be providing written comments, but I think that it's more important that we do this well rather than quickly from my own perspective.
okay, thank you for that. And with that being said, if anyone has comments or feedback on Purpose 411-03900, line item 14 to 29. Beth Englander?
Thank you. I am so sorry to do this, but I have already opened up all the documents that I got regarding this rule advisory committee, but I did not see any proposed rules, like actual language of rules. Could you could you ask someone to resend so I can be looking at the document that you're looking at? I know you're showing it on your screen, but it's hard to peruse when someone else is driving. And I
Yeah.
wonder, I don't know if I got left off, or if I missed something, which is of course always possible, but,
Yeah, they were sent last week on Monday, but we'll get that sent to you.
do you remember who sent them? I can do another search.
It's through our generic email, agency with choice,
Wanna raise my
awc.info
hand?
at odhsoha.oregon.gov, but we'll have it resent to you. Thank you. Marcia?
Well, I want to second what she just said. I did not receive the document. Um, I on the rack standing with great honor in the place of Ruth McEwen. So it might not have shown on the list that you emailed out. Anyway,
Yeah.
and about trying to get it done by the deadline, isn't it the group itself that set the original headlines, deadlines? We set who set the parameters for the timeline that this was to be finished?
So the program itself has to be ready and set with procurement and all the steps for January 1st of 2026. It has to be complete or so with that being said, that's where the timeline comes through. And we can send that to you, Marcia, resend that to you. I'll have.
So we have. Oh, okay. Sorry.
No, it's okay. Trying to see if another colleague of mine or team member can send that out to you since I'm trying to find, I'm facilitating right now. But
I can go ahead and send them out. If I could get, Beth, if I could get your email, that would be great. And then I can go ahead and forward. I have a email ready to go. Andrea.
So because it has to be ready in a year, we have only these meetings in January to go over all the rules.
correct. The timeline that we got was by the end of the month of January, we have to finish with the rack. But with that being said, we'll send that out. And I'm also looking for your email. Give me a second. And to resend that out. And if anyone has any comments for, again, purpose, Marissa?
Thank you so much. I couldn't tell if my hand raise thing was working. I think I clicked it a bunch of times. Sorry about that. I was just going to say, do we know what the timeline for the health authority rules process was?
I know it's the same timeline unless, because we are doing joint licensure together. So all of our timelines are the same as we're moving this forward together and collaborating together.
Well, I guess my comment is more about what it was originally, because the addition of doing collaborative rulemaking is a relatively new change. So I was just wondering if they had a longer timeline since they have joined forces with us, if maybe we could switch to using their timeline as opposed to the aging and people with disabilities rulemaking timeline.
Andrea, I can answer that. This is Connie Rush with the Mental Health Licensing and Certification Unit. We're in the Behavioral Health Division of the Oregon Health Authority. Our timeline was exactly the same as the Department of Human Services timeline. We're both in this bill with the same requirements. There's no difference.
Sorry about that. I was trying to get Marcia's email, but I found it. Oh, with that being said, let's go into the purpose again. I think no one probably has any comments unless someone does, and they can raise their hand now. If not, we'll move forward to the definitions. So moving forward, definitions, roll number 411-039-0010, line item 30 to 612. And these definitions are just defined, but they are more within the OARs. Tina? Okay. Tina, if you didn't have your hand up, then we'll move forward. If anyone, again, once again.
I'm sorry. I did have
No,
my
it's okay.
hand up, was trying to get it down and forgot to put my mic on. And I was apologizing, so just know that I apologized. My comment is under number 6, the definition where it's agency with choice means blah, blah, blah. I think because not all services, I understand why it's written that way, but not all services take place in the place of residence, meaning in your home. I think we need to add the words "and in the community" to the very end.
Thank you for your feedback, Tina. And we'll take it under advisement.
Self-directed agency
Thank
with
you.
choice services.
Thank you. Can we please mute ourselves if and I see and I'm sorry if I'm saying your name wrong, but Eugenia, hands up.
Yes, this is Eugenia, and I'm with the Oregon Healthcare Association. I just want to point out a couple of things. So under 25, which is I think on page 27, page 7, there's a definition for critical incident. And I know that there may be some intent to pull in some of the concepts from the Medicaid access rules, but I think I'd be curious to understand whether this definition is going to apply to other types of license settings. It may be premature because I would think other license settings have a perspective on what should be critical incidents. And I do know that there are some components of that are outlined by CMS, such as, abuse and neglect, but it sounds like there's some pieces here that are also deviating from that. So I don't know that we want to pull that in here without having a larger stakeholder conversation around critical incidents and how that ties in with the Medicaid access rules.
Thank you. Thank you for that feedback. Well, we changed it from serious incident to critical incidents, and it did change the change into CMS, but we will follow up with your question.
Yeah, and then, I do have other comments around different definitions, but I can also hop back on and let other folks chime in first.
Yeah, however you want to do it, we can go now or as you're welcome.
Okay. I just want to be respectful of the time limits. So the other definition is under 35 then, because you're right, it still has a reference to serious incident and that's no longer defined. So again, it's under 35, page 10, line 298. Yeah, it's a serious incident there. So I think that that term is no longer defined. And so again, it ties back in. Are we going to look at serious incidents for now? Are we actually going to start changing things and defining critical incidents? And then, yeah, and then if you scroll down to number 38, it's individual. And it's currently defined as an individual who receives agency with choice services and supports. But I think under the bill, it's narrowly defined. It talks about individuals being someone who receives in-home services and supports through the department or the authority.
Thank you. I see Sharon's hand up.
Okay, I had it up a little bit ago, and so I'm kind of backtracking here. But on section page line 55 through 59, wait for an individual to access these services without being on Medicaid or having to go through the state. I mean, going through the state, but not having a care worker to be able to access the services. And then on line 87, and this it repeats several times through in ensuring the continuity of care, that the agency should be held responsible. They should have some kind of reporting when of the times that they're not, like a weekly or monthly, of times that they've not been able to provide the care that they were contracted for. And they should be maybe rated or somehow by that. And on 160, behavioral health assessment.
Hold your thought, Sharon. We want to make sure we capture your feedback correctly. So give it a few seconds here. Jenny, let me know.
I'm good. Thank you.
Thank you. Okay. You said 60, right?
Yeah, 160.
160. Thank you.
Yeah, and the behavioral health assessment. That's, one big issue with home care is hoarding, and that there's agencies, I know Multnomah County and Washington County both have hoarding task force. I don't know about other counties, but they provide training for the individual classes, seminars, whatever you want to call it. It's like a 13-week program that been repeated, I think, 5 times. But they also provide training for people that help people like me that know the right approach to hoarding. And I think that somehow that should be worked in as hoarding as a behavioral health issue.
Thank you.
And then again, in the same thing in 183, the community mental health program, that the hoarding task force in the counties should be competent to help assess that.
Thank you. Marissa?
Yes, thank you. So also on line, sorry, I've got too many things open here. On line 87, under the ensuring the continuity of care. So one of our confusions about how this has kind of been drafted is that it doesn't seem to be substantially different from a standard in-home care agency. Whereas in my understanding of the agency with choice model is that supervising caregivers, scheduling caregivers, and these sort of efforts would be actually the responsibility of the program participant. And that's one of the main differences between this type of a care environment as opposed to others. So I just wanted to flag that in general. We shared a kind of leave behind piece or a 1-pager, if you want to, although it is a 2-pager, that describes the differences between the types of agencies, which might be helpful to share with the group as well. Thank you.
Thank you for that. Courtney? Oh, and give me a second, Courtney. Just making sure that Jenny captures the comment.
Thank you. Go ahead.
Thank you.
I'm this is Courtney Graham with SEIU Local 503. I'm mostly responding I want to like ask an additional question in addition to what Eugenia asked about definition 25, critical incident. And I think I might have similar questions on other definitions, but it does seem like this reads to me as like a new definition, and it is odd to me to create this new definition in this set of rules and either not refer to a different definition or like duplicate a different definition, because I make an assumption, I'm just acknowledging that critical incident is like a term of art somewhere in Oregon statute or administrative rule. And so I want to better understand, if this is going to apply here, why it wouldn't then be mirrored elsewhere. And then I think Eugenia makes a good point that like that's a bigger conversation. But to specifically introduce like that list of a critical incident here would make no sense, because that's like not really within the scope of the bill.
Thank you, Courtney. All right, we'll go to Tina.
I ask a quick question in trying to save us time in that I sent in all my suggested comments or edits or whatever for the whole OAR to the address given before. And so should I just assume that you have my information that I shouldn't necessarily, I guess, chime in and talk about ones that maybe aren't programmatically very important, but are more like the ones that don't read right because it's a list of what someone will assist the consumer in doing and those kind of things, and I can just be quiet about those? Or do you want us
Thank
to
you.
mention all of our?
Thank you, Tina. We did receive them and we're working on incorporating that feedback in there. If there is additional feedback that you would like to bring up, you're welcome to as well. But we are incorporating your feedback based on the information we got earlier. Thank you.
Okay, thanks. One more. Okay, then while I'm on here, I'll just say, I think there's a little bit of back and forth use. If we could get some continuity of the terms authorized representative or let's see, it's on the next page, I'm sorry. Individual representative or individuals representative. I know legal representative is very, very different, but I think we mean the same thing for those two, and they're sort of used interchangeably throughout the rule. So if you just want to maybe bring some continuity to that if possible. Thank you.
Thank you, Tina. And with that being said, since we do have a tight agenda, we're going to go ahead to the next section. Everyone else that has more comments, please send us an email. I'm going to provide the generic email in the chat really quick. That way you guys have it. Please send us any comments, feedback. There we go. It's in the chat. So we're going to go into the application for licensure, and that's OAR 411-039-0020, line item 613 to 817. We're going to give it a few more seconds to see if anyone has any comments for the section applications for licensure.
I do have one question. Oh, sorry.
Yes, go ahead.
I do have one question. If is there any provision for as independent contractor working as do they have to go through all the supposing somebody wants their grandson to be their caregiver or whatever the title is, that that he would have to go through all the licensure just to take care of his take care of his grandmother, or somebody might have a friend that does housekeeping and housework, and they want their friend to be their person. And so does the friend have to go through all the licensure, or is there a shortcut for an independent contractor?
So I think like the agency with choice will play a role of co-employment with the individuals, so consumers. And so they would have to go through the same background check, but it would be in calibration with the individual, the consumer who has services. And we can provide that information as we get into the other OARs.
And Sharon, I think more specifically to what you're thinking, the individual caregiver does not need to get licensed. It's the agency who hires caregivers that gets licensed. So
But
they would
what
need
I was thinking was that if somebody's an independent contractor, they wouldn't be working with an agency.
Yeah, they'd be a private care
Yeah.
worker then.
So wouldn't that be a good opportunity to point out that would be a different program?
Mhm.
So maybe you could do that, like distinguish that for us so everybody's clear.
Okay.
Thank you, Bethan.
What program would that be a part of? Can we clarify for her question that she just raised now?
I think it would be the in-home care just services and consumers contracting with just hiring their caregivers directly. And we did send a comparison chart in the email, Independent Choice Program, ICP.
And so just for clarity, that's not a situation that applies to this this rulemaking.
Correct.
Yes. And then my other question is, if we provided comments in the last meeting that we have, I'm thinking about the definition of it. It's on line 598 on page 18. If a national criminal records check, we talked about in the last RAC about defining when one would be needed and who would decide it was needed. Can I assume those comments are good for this RAC too? Or do we need to repeat the comments here because it's a new set of numbering?
I would repeat, or if you want to send us through our generic email the information, that would be great too. We are going to go, once we get to that OER background check, we can discuss further. And as well, want to make sure that I get to Marcia and the rest, so make sure that we call on you. It's important since people are waiting with their hands up. Thank you. Marcia?
A general request, the next time we see this document, could you put color shade variations in what was what was the original one and what it was changed to, So when we review it, we don't have to go through each sentence and think it through and what it was the comment that were made in this meeting changed. It would make it a lot easier to see the development of thought.
Thank you. Marcia, let me know if you received the comparison form as well that we sent out that kind of outlines what was added from behavioral health and what kind of the language that changed as well. So that was sent out and we can resend that to you, Marcia, and see if that helps as well. Thank you.
My question is about the forthcoming document. After what we talk about today, the next document issued, can you make demarcation of what it said originally and what it was changed to using, I know in Word you can do it.
Like track changes, we can send that out.
I don't understand what track changes are.
So we can send a document where you guys can see what was, what's the difference or what are the things that changed in track changes. It has different color letters or.
Okay. That would be helpful.
Thank you. Courtney?
Thanks. Beth Ann sort of jumped in to do this clarification, but I do want to make sure that like we're trying to keep our comments germane to this bill and clarifying like what is relevant to the underlying agency with choice program and what is sort of out of the scope of this. And then I just want to add a +1 to if it would be possible as you all incorporate changes going forward to do track changes. I understand the agency is probably reluctant to do that because it makes it obvious where you take feedback and where you don't. But I do think it would be helpful to understand like how you are incorporating feedback going forward. And I don't necessarily need you to respond to that, but that's just, I'm just saying, I think I echo the belief that it would be helpful as you incorporate feedback to track changes.
Thank you, Courtney. And with that said, if anyone else has feedback in this section, we're going to move along with standards of license renewal. That's OAR 411-039-0049, line item 877932.
I do have changes in the previous one. I have my hand up.
I know, but since we have a tight agenda, if you can send that over to us or put it in the chat. We're moving on to the standard for license renewal. Marissa?
My hand was up for the oh, here we go. I do have something in this section. Okay. The validity of the license on 864, a license is valid for 1 year unless earlier revoked or suspended. Just would love some clarification or discussion around the thinking for having a license only valid for 1 year. And then additionally, the license must be conspicuously posted in an office area that is viewable to the public. I'm not certain that the type of office that would be managing agency with choice would be a public office or even present in the state, perhaps virtual if it's a national organization. I don't know the answer to that, but have some questions around that. And then I guess my other questions are in the next section. So those would be the two main points.
And now that I have you on, I do apologize, but let's go back to the other comments really quick, and then that way the recording can capture it as well.
Okay. I'm scrolling here. Okay, so we have on 698, the personnel operations, including a well-defined process for hiring, training, evaluating, and managing staff. Because the So I'm not sure if staff just means staff of the agency with choice administration of the program, or if that includes frontline staff, in-home workers. And then the pre-employment screening and background checks. Just wondering how maybe that would need to be defined differently, or give some consideration to the fact that this is a co-employment model. And so just not sure what the requirements around a background check would be, other than other things that are statutorily already required. But this just seems a little vague, considering that this will be a shared responsibility. And then regarding the qualifications and determining that those are being met, again, that evaluation of the care being provided in the home is the responsibility of the program participant. So this is just kind of, this section seems to really be kind of conflating what is the responsibility of the agency with choice versus the individual. And then a little further down, medication assistance, medication reminding, medication administration and management, the guidance of the individual or the individual's authorized legal representative and oversight of medication. In many instances, an agency with choice is not having a medication management role. That's my understanding. So I have some questions about that. And then again, when would a criminal background check be, quote, necessary, and who would determine that, under line 741, number 5. Thank you.
Thank you. And I'm going to give a few minutes for Jenny to finish the comments. Number 5, Jenny, the criminal background check. So if you want to highlight number 5 on 741, line item 741, in regards to who is responsible or the process of the background check.
Thank you. Okay, thank you.
Thank you. Sharon?
Yes, on line 827, possession of a bachelor's degree. It should specify what the bachelor's degree is in. I can't see that an art history bachelor's degree would be any help. And I'm actually wondering at the necessity, if somebody has a history of management in health sciences, that actually a degree would be of any use, really. And then in page on line 890, the change of ownership, and it said that it needs to be on a form, but there's no time frame there, so I think there should be a time frame added, like 2 weeks or a month or whatever, to notify of a change of ownership.
What, I'm sorry, can you repeat what line that was on?
That was on 870.
Okay. Thank you.
Thank you, Sharon. And Marissa, we'll go to you. Jenny, we're good?
Yes.
Thank you. I was just wondering, oh, sorry. Go ahead.
No, it's okay.
I was just curious. Okay, so are we in 0030, the standards for initial licensure, or where are we at now? Are we moving on, or is that it?
So that one, we're going to review it on the 24th. So the agenda what had the list of all the OERs. Right now, we are finishing with standards for licensing renewal, and we're going to skip to 411-039-0060, the ones in between. are going to be reviewed in the next meeting.
But can you share a little bit about why we're moving the order that way?
There are still some collaboration that has to happen within those just to make sure we are aligned with just the ORSs and stuff like that. So we're just clarifying a few things that we need to, and that is the only reason why. And we're skipping those ones for the next RAC meeting.
Okay, so now we're at 0060 reporting and billing requirement.
Yes, line item 955 to 1059.
Thank you.
Mhm. Marissa?
I'm sorry, I was trying to turn it off. Sorry.
Oh, no, it's okay.
Marissa, that was the easiest comment to document.
I win.
We'll wait a few more seconds to see if anyone has any comments. All right, let's move into the services provided. Oh, Courtney?
I'm slow, sorry.
No, it's okay.
On line 1016, which is 7 sub C, which is on page 28. I understand why you all put this requirement in there to not exceed 60 hours a week, but no other provider has their hours limited like this, and it makes no sense to do that unless you're going to extend that limitation to other private provider types. So I would ask that line not to exceed 60 hours per week be either struck, or we have a larger conversation about applying this to all other providers.
Hey, Courtney, this is Tracy Lerner. I'm a home care worker operation and policy analyst, and we do have a limitation on other providers based on the collective bargaining agreement with home care workers.
That's not true for DD agencies, though. So I don't support that requirement. We've been really clear with you all that that is the contract for folks in the independent provider unit, but that is not true for other kinds of private providers.
And
provider in this sense means provider agency. Sorry, not provider as an individual. You don't place that cap on any other type of worker for a private provider.
Okay, and I understand that. And we will definitely take your information and make sure it's in the notes. I can say that, I mean, these rules are for licensing agency with choice. And so that is why we put that in there.
Thank you, Courtney.
And I understand that. I guess I'm just going to be clear. I'm going to continue to oppose that inclusion because you don't include that for any other licensed provider type. So I'm just going to be clear about that in this meeting so that people hear that.
Thank you, Courtney. And Crystal?
I'm sorry, I wanted to go back to the nationwide criminal records check. So this is for somebody who's getting licensure to provide the agency with choice model, right?
Correct.
So why wouldn't it automatically be required that they have a nationwide criminal background check, especially after what we've seen happen with the other agencies in the state that are under investigation?
Well, it is required. We want to make sure that the agency with choice is accountable to make sure that there's a background check, which is going to be our background units. But we can talk more about that and in the background OAR section, we can go back because
I would just like to have the word "if" stricken.
Okay.
And say a nationwide criminal background, whatever check.
Can you
needs to be done.
refer to what line number you're referring
741 at 5.
Anybody getting dizzy? 741.
That should just be an automatic requirement.
Thank you, Crystal.
I mean, if our providers have lived out of state in the last 5 years, they're required to have a nationwide check. So why wouldn't they?
Thank you.
Thanks.
Beth Englander.
Thanks. Let's see, in
The reporting.
in 0070, I guess I'm looking at line 1062 and 1063. I just I think it would be really helpful if the rule was clearer that an agency with choice agency is required to provide help with all of the ADL and IADLs. Otherwise, I can see a situation where agencies could kind of like exclude some ADL help or IADL help, and that can have really serious implications for people who have contracted with them, especially if those change and if the agencies are allowed to change which ADLs or IADLs are assisted with. And then on line 1097, well, the section starting on 1097, I would recommend including words that require the agency with choice to evaluate whether an individual's person-centered plan meets their needs in collaboration with the individual who's receiving the services. The way it's written right now makes it sound like the agency can independently just take a look at it and make a decision without the input. I know that is like the opposite of what person-centered plan is, but I think being clear about that would be important. And then in 1108, in subsection 5, I think that's a really important rule, and I really appreciate it. I am just going to highlight that is not like resident. I don't think residence home is not defined in the definition, and neither is residence. And I'm a little worried that might cause problems unless I missed it. Is it maybe residences? I looked for home and that wasn't defined, but maybe residences.
Thank you. Thank you for that feedback. Just a reminder, we're not going to go back to the OARs we just visit. We're moving forward. So right now we are in the services provided OAR 411-039-0070 line item 1062 1119. If anyone has any more feedback, and I see that Marissa, you have your hand raised.
Yeah, thank you. 1076, an agency with choice that supports individual with medication reminders or assistance. So just to be clear, in the original information that was provided to create the fiscal for this program, the inclusion of medication assistance is not one that's typical of agency with choice for a self-directed model. So the inclusion of this type of defined medication support is actually dramatically increases the programmatic costs of agency with choice in general. So there's that. And then on 1097, so the original requirement was 6 months, and this has every 3 months, and I'm just curious what changed, why that's changed, and then also that the agency with choice must ensure that the evaluation aligns between the individual and the direct support worker. It's my understanding that alignment and that even what those elements are is really the individual's primary responsibility. So I don't know, this just seems again like another one of those instances where for self-directed care, this seems out of place. That's all.
Thank you, Marissa. And I'm going to give it a few minutes for Jenny to capture that. And once she's done, we'll go with you, Courtney.
I'm ready.
Thank you. Courtney?
This is somewhat of a question based on maybe a misunderstanding on my part. Is the agency of choice or any other like licensed provider type, are they the entity responsible for like creating on their own that person-centered service plan? Or is that something that's also done in collaboration with the department, or in this case, like a AAA or other case management entity?
I think it's like it's going to be both. So when we open it up for, I guess the RFP, when we open it up, they're going to be able to let us know how they're going to do that. We want to hear from them. How do they plan? We're going to score them because it is a competitive RFP. So there might be a time where we're going to ask for more clarification in regards to fully understanding in detail, how does that look? How does the process look? What is their intent, outcome, etc. There's a lot of that we're going to ask. But these are the OERs will help just hold them accountable for that. But yes, good question.
And just to ask a clarifying question based on that description, I guess, again, I sort of believe that it was the responsibility of the like case management entities or like DHS and OHA to do that, specifically that planning, and then like a licensed provider is executing on that. And if that is the case, then I think the phrasing of this, like 1097 sub 3, is not totally like in line with that. So I can submit those I'll submit that as a comment, but I just want to say, as currently written, if it is not necessarily the licensed provider that is creating that person-centered service plan, but that's something that the department or like its designee is doing, then this implies that it's the agency who's responsible for that, the licensed provider. So.
And let me clarify, the policies that the agency with choice should have is to be able to provide the person-centered services within like the procedures and stuff, but the individual and the case manager with the department or contract behavioral health uses a different language, coordinator, case coordinator. So it's going to be the AAA offices or DHS offices, local office departments, and insight with the individual's care needs. But thank you, Courtney. Tina?
I think you just answered my question, but I was just going to say the Code of Federal Regulations talk about you cannot spend Medicaid dollars unless the person-centered, do they call that? I use all kinds of different languages. But anyway, the person-centered services plan is done with the case manager or so it'd have to be the authority or APD or APD's AAA offices. And then when the agency with choice, if they, sign up to work with them, they could have a service plan and they could call it what they want. But there still has to be a person-centered services plan with the authorities.
Mm-hmm. Thank you, Tina. So we're going to move on to operational standards. That is OAR 411-039-0080, line items 1120 to 1485. Tina?
Sorry,
No, you're
one
good.
comment after another. Well, this is a big problem, as you know. As a disability advocate, I had problems from the beginning with this, and I've talked to just about everybody with it, so it won't be a surprise. But the way I kind of worked it in to the OARs, just as a suggestion, is I continue to wonder how we can guarantee personal direction or person-centered services or whatever if some of the services that the agency with choice is going to provide include things like assisting the individual in recruiting and interviewing and making selection decisions, on the direct support worker, setting work schedules, determining corrective action, and dismissal things. If that person that's going to help them is a potential or current direct services worker, there is a big conflict of interest there. Not only a conflict of interest, but it is a huge power dynamic problem for me.
Thank you, Tina. And
Thank you.
I have noted that, so that way we go back to that.
Okay.
Appreciate that.
Thank you.
Marissa?
Thank you. On 1131, that's correct. We're in that section, right?
1130.
Yes.
Line 1131. Okay. Agency with choice must clearly outline in writing. Oh, wait, not that one. Sorry. Down to 1140. An agency with choice must maintain responsibility for ensuring that all services provided are aligned with the individual's needs and preferences. So this seems to kind of put it on its head. When I read that, I think, well, shouldn't the individual be the one determining the alignment of the services with their needs and priorities? Like, isn't that sort of the whole idea of what differentiates it? And then on 1145, similarly, I'm just a little curious what professional oversight really means. So if anybody could provide, I'm just like, who's the professional and what's the oversight? If that could be a little defined, that would be great. And then on 1153, it says that the agency with choice must ensure that services are delivered statewide, tailored to meet the individual's needs, and provide appropriate and timely delivery. I mean, this just seems, again, a little bit put on its head. Like the individual is the one making sure that their care is tailored and timely. That's kind of the whole point. So the language of this just seems a little outside of what we're trying to get at. And maybe there's some reason why it just kind of comes across as clunky, but I wanted to flag that it's not clear. And then down at 1168, travel plans are described and documented in an individual's person-centered service plan. Looking at the person-centered service plan, it looks like, and I know we'll get to this section, it looks like it's done at the time of entry to the program. And so I would want to compare
What
this
line item, Marissa, again? Sorry to
Sorry,
interrupt you.
1168 and 69 says, this is in the section around local service area. And so 1168 and 69 defines that travel plans should be described and documented in an individual person's centered service plan. And I just wanted to flag that. I know we have to get to the section around what that service plan includes and what the parameters of the timeline for that and review of that is. But I just want to flag it because if that person-centered service plan isn't updating very regularly, like monthly, which seems like it would be pretty insane to have a monthly change to a service plan, then you don't have a meaningful opportunity to put your travel into a service plan. So, and it just seems unnecessarily restrictive to require that travel plans be in the individual person-centered service plan. Thank you.
Thank you. I see that we have 6 hands up, but I want to be able to also mention before I go with the next person that has their hand raised that we'll take a break after. I think the last person with their hands up that I can see here is Sharon. So after Sharon, we'll take a 10-minute break and we'll continue. With that being said, Marissa, was that all?
Yes, thank you.
Thank you. The next person is Eugenia.
Yes, this is Eugenia again with the Oregon Healthcare Association. on page 33, beginning with line 1223, this is the one around initiating internal investigations. And I'm wondering if maybe there's just some typos in there, because it says that those investigations are to be initiated within 24 hours of receipt of receiving prior authorization from the department or authority. And I'm not sure that that was the intent. It makes it sound like they can't do an investigation until they get prior authorization. And also within that same kind of section, the subsections focus on abuse allegations, but that opening paragraph talks about complaint, grievances, incidents, critical incidents, and other things other than just allegations of abuse. So it may just be some cleanup in that section to clarify the protocols for internal investigations.
Yes, thank you. And I think it was a typo. And thank you for that. We'll go next with Beth.
Thanks. I put something in the chat, but I was hoping, I appreciate in this section and a couple of the sections that the rule that there is really a focus on what the individual who's receiving services wants, like which caregiver they want to give them care and what services to get, etc. But we have clients all the time where they want a particular care worker, but that care worker doesn't have enough hours to spend with just them, or they've promised their care to several people. How are agency with choice agencies gonna be required to deal with a situation where they cannot give the person what their person-centered plan would like, which is like only getting care from one care worker? It seems like that's kind of the point of this program in some ways, but not always possible. Is there any policy person that could explain what it's supposed, like how this is going to be dealt with?
Thank you, Beth. Well, we are going to have the agency with choice also have a backup plan and have other individuals ready to go, right? But in that aspect, I think it's very important for there to be communication, as agency with choice and the individual are co-employers. Very important for there to be communication between both of them and being able to let them know the situation in those regards, to let the individual make those decisions and get informed based, like you mentioned, there might be a direct support worker that could only have 10 hours, but the individual to be able to understand that and then go to plan B, because it's very important. And I think plan B, we backup plan for anything to be part of that care plan for whatever reasons, like instances like these. And we're hoping clarifying that in the OERs would help manage with those circumstances. But we'll take your feedback into consideration as well as we're re-reviewing the OERs. Molly?
Thank you. So lines 1282 to 1287-ish. Just a question here, I guess, on reasoning. I think statutorily, the cultural competency training is required every 4 years. I know for home care workers, PSWs, PCAs, there's an approval, like a plan for every 2 years with their continuing education. So I'm just curious about the requirement here for upon hire and annually thereafter. And wonder if it makes sense to have that more stringent requirement.
Thank you. Thank you for that feedback. Sharon?
Okay, on 1268, this I think that this needs to be expanded on, that all training described by blah, 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 and blah, 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 that it needs to there needs to be a single standard of training. And then on line 1303, if an individual experiences discrimination, and then it gives 4 or 5 places that they need to report it to. I think there should be a single reporting entity that would follow up with the other agencies. Because it's confusing enough when you're dealing with the state, when you're older. And then 1332, engage with it and work closely with individuals to design and implement services by appointing individuals to the advisory committee. And who's going to do that? And then 1377, when Medicaid is the source of payment for the services provided by the agency of choice, the Medicaid is considered the for the total payment. And in my situation, I'm in a skilled nursing right now. When I go home, I'll be having home help for PT and OT, and I think nurse visits. And but I will also have my agency, my caregiver, who does most of my housework and be helping with bathing and stuff like that. So I'll have 2 agencies. And, it seems like this, I don't know how that gets sorted out, but anyhow, it's just seems like something that needs to be looked at when there is somebody with 2 agencies. That's all.
Thank you, Sharon. And the last person raising their hand before we take our 10-minute break is Tina.
No, once again, I apologize.
Oh, no.
But yeah, I would probably be kicked out of the advocacy unit, not unit. I'm sorry, I don't work there anymore. But what I mean is I have to make this point, and I know that staff has got access to my comments, and I can't tell you how much I've enjoyed you all listening to my comments, especially about consumer control, empowerment, and all the things that people are, trust me, so worried about this program because of. And what I keep trying to do is ensure them that you all get it. And so I think it's very important that in the OARs, every time we can, we stress that the consumer is directing the services. And so there's under, and I don't have my lines, but it's under the travel. It's like when you get permission to travel. My concern is B under A there says report to the agent. This is the direct service worker has to report to the agency with choice administrator or administrator's designee either by phone or electronic mail the status of the individual before leaving the service area and immediately upon return. And I can't tell you how offensive that term is. What about my status? Needs to be reported to an administrator who may or may not even have met me. And what is my status anyway? I mean, my temperature, my blood pressure, my attitude. And I guess I just think this is not necessary. I think, for them to call in and say, we're leaving now is one thing, but to report on someone's status is so paternalistic. And I guess it's patronizing in my view, and I would never choose this kind of service if the OARs say and use this kind of language, because to me it says they're not going to really understand consumer choice. Thank you.
Thank you, Tina. And with that being said, we'll take a 10-minute break, and it is 2:10. We'll see you guys back at 2:20. We'll be here.
What?
It is 2:20, so we'll continue. Welcome back, everyone. Hopefully that was a good, nice break, 10 minutes at least. And with that being said, we will begin with policies and procedures, OER 411 039 0090, line item 1486 to 1553. Marissa?
Well, it helps if I unmute myself.
It's okay, it happens.
Okay, so one thing let's see, where is it? I was looking for, there was one, electronic visit verification requirement. So 1498 and 1499, section B, under policies and procedures, it says ensuring direct support workers are compliant with electronic visit verification requirements. I was just wondering if that's sort of standard or if that is consistent with agency with choice. And if you know if that's the case, because I don't, but I was curious.
And Tracy helped me out if you're here, or Jason, but I think it is consistency with just all the other agents in home care agencies. It's an electronic verification system that a federal requirement that the agencies must have.
Correct.
Thank you.
We'll give it a few more seconds to see if anyone else has feedback on policies and procedures. OER 411 039 0090. Sharon? I think you're on mute, Sharon.
I think you're still on mute.
We still can't hear you. Let's see. Well, Sharon, if you want to type it in the chat, your feedback or comments or anything. I was trying to see if I can unmute you myself, but I'm not able to. It doesn't give me that option. So we'll move on. We'll go, if there's no other feedback for that section, we'll go to background check 411 039 0100, line item 155421590. Sharon, can you, I know it's still not, Marissa?
Yeah, thank you. On 1574, the background check must also be conducted on all subject individuals every 2 years. So then this kind of just highlights there's some inconsistency. Earlier in the document, it said if one is needed. I think that specified if a federal one was needed, but probably just want to clarify between those two things. And then this one says it'll be done every 2 years. A lot of the other timelines are different than that. Licensure timeline is every year. The personalized plan is every 12 months. So just curious why this is 2 years, and whether or not there should be some consistency around that. Thank you.
Thank you for that feedback.
And Tina, this is Jenny. I just wanted to let you know that I have your comment about the other inconsistencies, and I'm keeping a separate notes for things that don't apply to line items, just so you know.
Thank you, Sharon, for that comment. And let us know if your mute button works to go on mute. But if no one else has any feedback on the background check section 411-039-0100 line item 1554 to 1590, we'll go to our next section, which is emergency and continuity of operations planning, which is OAR 411-039-0119, line item 1591 to 1688. Molly?
Yeah, just on line 16665A, there's just something missing here. I think like the agency with choice must some kind of drill or test must be conducted, but there's just a word missing that makes it a little unclear. So wanted to point that.
Thank you, Molly. If there's no any other feedback, we'll go to agency records 411-039-0120, line item 1689 to 1715. If there's no feedback in that section, we'll go into the section administrator qualifications, OAR number 411-039-0130, line item 1716 to 1822. And if anyone has any other feedback that comes up in a later time or even after the fact, please email us with that or put it in the chat. We really want to hear from you guys. And once again, I'll put the generic email in the chat. That way you guys have it anytime. Please send us the feedback. If no one has feedback on this section, we'll move along to the direct support worker qualifications and requirements. That is OAR 411-039-014940, sorry, line item 1823 to 2094. Marissa?
Thank you. 1909, direct support workers must complete appropriate caregiver training from a qualified training entity, etc., and have their competency evaluated and documented by the administrator or the administrator's designee before they independently provide services. So, and a evaluation. So this sort of contradicts the will or the participant having and maintaining control over their evaluation of the person providing the care and evaluating their competency and their ability to carry out the role. That seems to be conflated. In agency with choice, the training will be a collaboration to make sure that that takes place, but this evaluation piece is for the person receiving the care to determine.
Thank you, Marissa. Molly?
Yeah, can I just clarify? I guess on that last comment, I was assuming that that evaluation referred to like an assessment of the training that's required. So, a competency assessment. Yes, I took this training and I understand what it means. Is that right? Or is that referring to what the last commenter was talking about?
Is Tracy, are you here?
I can probably take it, Andrea.
Okay, thank you.
Go ahead.
This is a baseline training. This is not person-specific training. This is a baseline training that all caregivers would be required to take, separate from individual training that is specific to the person that is actually receiving the services.
Yeah. So Molly, like the mandatory core training.
Great. So that evaluation referred to is like similar to an assessment the worker would take after training to say, yes, I understand the material, basically.
Thank you, Molly. Sharon? Oh man, you're still muted. Not sure. It doesn't allow me to unmute you. Yeah. If you want to provide the feedback in the comments like you did before, or feel free to email us as well. Sorry about that, Sharon. But if you're able to unmute yourself at any time, let me know, and we'll go ahead and go to Crystal.
I just want to state that these requirements for the trainings and so forth, that's standard procedures for home care workers, personal support workers, and personal care attendants currently. So that's not different. That's the way it is now.
Thank you, Crystal. Well, I don't see any more hand raised, so we're going to go on to personal records, which is OAR 411-039-0150, line item 2095 to 2158. Molly?
Yeah, sorry, actually, I couldn't get my hand up fast enough, but it's on the last section. I can email it in or make it a comment in the chat.
No, let us know.
Well, I'm just thinking back to the cultural competency training that was referenced earlier as a mandatory training upon hire and annually, and then I don't see it referenced here. And so I just think it would be good to look at those two pieces together. For current IP workers, cultural competency is not due at hire, it's due as part of continuing education. I think it would be great to keep that same kind of system instead of creating different requirements. But if it is going to be part of that initial training that's required, I think it should be listed as the topics that need to be covered in new worker training.
Thank you, Molly. Once again, if there's any comments on personal records, OAR 411-039-0150, line item 2095 to 2158. We'll go on to the next section, which is disclosure, screening, and acceptance of individuals. 411-039-0160, line item 2159 to 2283. We'll give it a few more seconds. Right, heading into individual records, OAR 411-039-0170, line item 2284 to 2371. All right, moving into individual rights, OAR 411-039-0180, line item 23722485. And Jenny, let me know if I'm going too fast for your comments.
Oh, thank you.
Marissa?
Hi there. I was sort of reviewing things. So are comments for 2505 good for this section, or am I ahead of myself?
Uh,
I'm ahead of myself,
what?
aren't I?
I think so. We're on the
Okay.
3. We're almost there.
Sorry. Okay, bye.
No, you're good. Well, with that being said, we'll go into the service plan. OAR 411-039-0190, line item 248622603. Marissa?
Thank you. Okay. At line 2502, the administrator, in collaboration with the individual, must complete a written service plan within 7 days after the initiation of services. So it's just called a service plan here. I'm just curious, like, if this needs to be aligned with I mean, is this the individualized personal service plan? And if so, maybe it would be wise to be a little more clear about that and potentially a little more clarity around the ongoing use of, oh wait, here down here is no, I don't see it. So maybe a little clarity around like when that will be updated or revisited and how that relates to other service plans. I don't know. I got a little confused about this, whether it's different or the same and what the timeline is compared to other timelines. So that's one comment for clarity. And then down at the types of services being received under 2528, section C, again, the medication, that's a cost driver that was not included in the original comprehension of what this agency with choice model would look like. And then the I'll get back to you on that one. I got to get some more information. And then 2576, the authorized legal request changes. I'm just reviewing my own notes here and they're a little bit long. I'll put my hand down and see if anybody else has anything to share while I get some more clarity. Thank you.
No problem. Thank you. Tina?
Yeah, I looked up my line items this time, so I'm talking about 2587. Is it time for that?
Let me 20. Yeah, I think we're in.
Okay. Okay. It's item 11 and 12. And my comment really is I can see subtle differences in 11 and 12, but I think a lot of people, including me, would be confused as to which one is used. And then it also would matter to me about who's taking control of the situation. It's about, when there's a change in whether a provider's available and those kind of things. I think, let's see, it seems like if 12 is working like it should, like I think it was defined earlier, the individual should have a backup plan, may or may not work, and I understand that. But they would then say, oh, okay, thanks for the call. My worker's not available. I'll call my backup, or they can call it. I don't know, but I'm just saying somebody has to work that out. But 11 really is prescriptive about, sounds like the agency with care can just call you up. I mean, not just, I mean, they're in a bind. There evidently is some sort of the provider's not available or whatever, but it said they must ensure the individual or their representative, blah blah blah, is notified of unforeseen changes. And when I read these are scary. It's in the delivery of the agency with choice service plan as applicable, such as a change in the direct support worker who provides the service, the frequency of the service, the days and times when the services will be provided, and the anticipated duration of these changes. That's pretty big. I mean, for a lot of people, and I have used personal care throughout a great part of my life, and so I understand how traumatic that would be if I've never met someone and the agency calls and says, we're sending out so and so because, there's an unforeseen circumstance. And by the way, they can't come on Tuesdays and Thursdays and Fridays. They're coming on Mondays and Wednesdays and Tuesdays, and they're coming in the mornings. And they can't provide X and Y, but they can provide Z and B or whatever. It seems extremely expansive about I don't know, just the direction of which we're going here with item 11 and 12. So if somebody could just maybe review that sometime, and maybe I've got it confused.
No, thank you, Tina. Thank you for that. We'll review those two. Marissa?
Yeah, thank you so much, Tina. I had some vague notes for myself, but essentially a similar thing. So just want to echo that that list of the things that could be changed and the manner in which they would be changed sounds a lot like a standard agency rather than an agency with choice where it would be collaborative. And similarly in number 12, the planned absence, those scheduling changes, when possible, would be the individual's choice to figure out those contingency plans and help weigh in on those decisions rather than having them dictated to them. Thank you.
Thank you, Marissa. I'll give a few seconds for Jenny to finish. Thank you, Jenny. Ed?
Yeah, I just want to reiterate that I agree with Tina's and Marissa's comments. I require, 7 day a week to get up in the morning. And if they say that, no, we can't get you up at 5:30, we got to get you up at 10, that doesn't work with my schedule. And anyway, I just agree with that. We need to clarify that.
Thank you, Ed. Just wanted to clarify that we'll look into it. And thank you for that feedback. We'll go into the next section, which is initial visits and monitoring, OAR 0411 411 039 0200, line item 2604 to 2708. And just so everyone knows, we do have 10 more minutes of this meeting. Giving it a few more seconds if anyone has any feedback in that section. If not, we'll head into our medication services. OAR 411-039-0210, line item 2709 to 2915. Give it a few more seconds. Marcia?
Does this include the administration and monitoring of oxygen? Or only oral medication?
It should include all, but we'll put a comment in here to make sure that we relook at the OAR.
Thank you.
Ed?
And I could comment on what about CPAP services, you know, if somebody needs a CPAP when they go to bed at night and cleaning the CPAP.
Thank you, Ed. We'll go into, if no one else has any comments on medication services, we'll go into infection control, which is OAR 411-039-0230, line item 2957 to 2988. Giving it a few more seconds. If not, then we'll go into Marcia?
Number 2, whoops. It says active surveillance, identification, prevention. What is the definition of active surveillance? By whom and by what means?
Let me see if we have it in our definitions.
I could say that active surveillance is really just a common term for monitoring for any type of infections or diseases that might be spread to others.
Okay, whoops. Does it include little pests that can get into a home? And if so, who does remediation? How is this carried out so it's resolved?
I think this sentence refers to infectious and communicable diseases.
Okay. Is there a section for identifying bed bugs, mice, rats, etc.?
No, the section's only involved with care needs at this moment. I think that's a bit outside of that, but
okay.
Thank you, Marcia. And we'll go into our last review section for today's meeting, which is quality assessment and performance improvement, which is OAR 411-039-0240, line item 2989 to 3025. And I see Ed.
Yeah, back to the medical and stuff. Is there any discussion on care of suprapubic catheters and bowel care in any of this stuff?
I think that would be included on the as a whole in the medical medication services, but we'll take a look into that, Ed. Thank you.
Thanks.
Marissa?
Thank you. So right up at the top, 2991, an agency with choice must establish and maintain an effective quality assessment performance improvement program that evaluates and monitors the quality, safety, and appropriateness of services. So I think while it does make sense that any employer, albeit a co-employer, would need some kind of process that's outlined if there's a clear and persistent problem with someone working there, but this seems to go a little too far in terms of evaluating the quality, safety, and appropriateness of services. Oh, this is for the full agency. I'm a little confused. Is this for a quality assessment performance improvement program for itself? Like they must create a process by which they will be monitored?
Yes, with the these are for the agency with choice.
Okay, sorry, I was misunderstanding. Thank you.
No, you're good. And if you have any other comments or feedback, make sure you send us an email, and I'll put once again the email of our generic email in the chat. That way all you guys have it in case something comes up later on or even before the next RAC, which is January 24th. Please feel free to email us with those things.
I guess I would just ask, is this because I noticed that there were surveys seemed to be like a sort of monitoring element in the previous set of rules, and they're not there. I didn't see surveys in this set. Maybe it's in a different section that I haven't closely looked at yet, but I didn't notice that there were surveys. So was the idea like to have agency with choice put forward their own recommendation for how to monitor their quality assurance, or instead of surveys, or are they related?
So with this current OERs, we just changed the surveys that you saw in the previous one, got it changed to inspections instead of surveys. We figured that the language would be easier to follow as well. And the survey you'll see a bit on the survey. The survey will be for the initial as a start, giving services under the agency with choice, and then we'll go into inspection. So the language did change from surveys to inspections, but you'll see the initial inspection, we called it survey.
Okay, maybe some more clarity in this section around the assessment and performance improvement in terms of like what the outcome of it, what the goal of it would be.
Perfect.
Thank you.
Thank you. Well, it is 2:59, right on time. Thank you everyone for everyone's feedback, comments. Like we mentioned before, please, if you have anything that comes up or that you have, feel free to send us those in our generic email. We'll be sending the agenda for January 24th, and I'll make sure I'll resend the summary of each OERs and work on sending the track changes, I just need to make sure that they're readable and they're easy to print. So it might take me maybe until Tuesday to send that out to you guys, but we'll be working on that. Let us know, like we mentioned before, if you guys have any questions, feedback. We appreciate all your engagement today, and we hope you have a great weekend, and we'll see you guys next RAC meeting, January 24th, same time, 1 to 3, and same link. Thank you all.